Attendance for smear tests is at an all-time low, and the narrative of its embarrassment is pushed heavily. When a white middle-aged man can see that the reason isn't down to embarrassment, there's an issue of sticking your fingers in your ears and going la 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 la, because the problem is probably that it's nuanced. There's multiple reasons why attendance is down. One of which is that actually they're told that quite often it's painless, it's just uncomfortable, which for many women it is, but for 1 in 10 that either has vaginitis or endometritis, that it is painful. And I've seen multiple accounts on Joe's Opinion and other places where they complain heavily that it's painful. They don't get any support if it is painful, and then often belittled or told they're a baby if they have issues. So there's also the issue of sexual assault. Some women find it really hard, even with a woman. I do know from experience that, because I've gone with a wife who said, because there was a man about and he stayed outside on the screens, but we said, we were concerned at first where he'd want to be there, and she said, well, you have whoever's on at the time. Well, no, it's not happening. I have seen stories where a woman's turned up expecting a woman. They said, it's a man, is that okay? They said yes, and they said, I'm never going again, because I worked myself up to go, and then there's just a break of mistrust. I know 55% of women don't have a problem with a man, but 45% do. And with the changing demographic of the country, I know from experience for women I've worked with that some are simply offended, not just no thank you, I don't want a man. They are offended, and there's a break of trust simply being asked that a man do it. So these other reasons as well. They say nurses are nice and everything. Well, I've seen multiple stories again where it shouldn't be a skill job, but for some women where the cervix is tilted or back, it can be quite a job to find it, and there is some experience needed, and an inexperienced nurse who's never done it before, I've only done it a few times, can cause pain and can cause blood. So all the staff are nice and are okay is simply not true. Also, GP surgeries are given a bonus, paid a bonus for if they get a certain percentage through. The problem with this is that some women that are still virgins are not sexually active are pushed into smear tests that they simply don't need. This has an effect, and it can't be ignored. So I have seen multiple stories, threads of healthcare professionals that say it only takes 5 minutes, it's only uncomfortable. Please don't tweet stuff like that. It's not, it's 5 minutes while you're in there, but we all know getting an appointment, that's another point. Getting an appointment can be an absolute nightmare. I've seen photographs of women's appointment cards saying this is your third reminder, and they're saying I just can't get an appointment. Let's have, keep in touch with reality. Women cannot get appointments. And then it can be a 45-minute wait outside, and then it can be at the wrong time of day, a really inconvenient time. So it's down to embarrassment, when quite often women that do want them simply can't get them. So can we have a real conversation about why women are not having them? I'm not saying embarrassment isn't doesn't play a part, but I bet you it's a very small part. Thanks, bye.